At 3:47 a.m., Beatrice remained awake at her kitchen table. She pressed both palms firmly against the hard surface, seeking a grounding physical sensation to drown out the troubling numbness in her hands. Just 14 days prior, her eye specialist declared her vision completely sound. He evaluated her visual sharpness, checked her papillary reactions, and observed the outer surface of her eyes, finding no cause for alarm. Yet, throughout all 87 years of Beatrice's life, no physician had ever examined the delicate microvessels lining the back of her retinas. These crucial capillaries had quietly endured steady damage from elevated blood sugar levels over 9 long years. Though her sight had not yet failed, these microvessels were progressively narrowing, losing their natural flexibility and capacity to dilate. Her hormone specialist diligently tracked her average blood sugar numbers, while her eye doctor routinely checked her outer vision. Unbeknownst to her, a critical medical gap existed right where metabolic health directly intersects with ocular function. Beatrice sat in the dark because this overlooked connection had caused her endless sleepless nights. Today, we are bridging that exact medical divide. The specific whole food capable of protecting both system functions boasts an extensive therapeutic history spanning over 3 millennia. Classical Ayurvedic texts, including the Sushruta Samhita, originally recommended this plant to treat conditions described as visual weakness and overly sweet blood. Modern clinical trials now validate what ancient medical practitioners observed long ago without the benefit of laboratory equipment. The superfood in question is standard spinach, available at virtually every national retailer, including Walmart, Target, and local discount stores. Fresh bags typically cost around $2, while frozen varieties often sell for under $2. Before detailing the biological mechanisms, we must examine the hidden gap in conventional senior eye care. Lacking an understanding of what standard vision screenings omit, the vital importance of vascular protection remains obscure. Standard eye appointments focus on basic vision charts, internal eye pressure readings, and outer structural evaluations. While comprehensive dilated exams inspect the optic nerve and macula, standard checks rarely measure the precise diameter or elasticity of retinal blood vessels. These tiny ocular vessels represent the only part of the human vascular system visible without invasive surgical procedures. Consequently, these delicate pathways offer an accurate snapshot of your entire cardiovascular system's current condition. When a retinal artery constricts, it signals similar vascular tightening throughout the rest of the body. A retinal scan serves as an effective diagnostic preview of your systemic cardiovascular risk. In individuals managing type 2 diabetes, ocular vessels experience endothelial damage similar to vessels anywhere else in the body. This damage stems from sugar-driven tissue damage, reduced nitric oxide creation, and progressive arterial hardening. Diabetic vision loss develops late in the disease process, long after structural vessel damage has quietly begun. Spinach directly combats this hidden vascular degradation through 2 clinically validated pathways, while simultaneously supporting healthy glucose management through a third distinct mechanism. The first primary mechanism involves natural plant nitrates and the internal retinal nitric oxide cycle. Spinach contains exceptional concentrations of natural nitrates, offering nearly 250 milligrams per 100-gram serving. Upon ingestion, beneficial oral bacteria quickly transform these vegetable nitrates into active nitrites. Your body subsequently converts these nitrites into nitric oxide, a powerful natural compound that keeps vessel walls relaxed and expanded. Research shows that natural flavonoids in spinach, such as quercetin, actively dilate retinal arteries through nitric oxide pathways. Spinach supplies both the raw nitrate building blocks and natural plant compounds needed to trigger vessel dilation directly inside ocular tissues. In practice, retinal blood vessels widen, dramatically boosting nutrient-rich blood flow straight to delicate visual structures. Furthermore, the structural barriers protecting retinal tissue from circulatory toxins remain significantly stronger and more resilient. The progressive narrowing driven by elevated glucose is effectively neutralized by the continuous nitric oxide signal provided by regular spinach intake. Consuming just 1 cup of raw leaves or a half cup cooked delivers a therapeutic nitrate dose easily accessible at any neighborhood market. Beatrice incorporated this exact serving into her evening meals. The second major pathway relies on high concentrations of lutein and zeaxanthin concentrated within the central retina. The macula, responsible for detailed focal vision, stores the highest concentration of these specific plant pigments anywhere in the body. Their presence within this specialized ocular tissue is essential, as the eye actively absorbs them directly from the bloodstream. Within the central retina, these twin carotenoids perform two indispensable, highly protective daily functions. First, they absorb harmful high-energy blue light, functioning like internal sunglasses for your eye's most active metabolic zone. Second, they act as localized antioxidants, neutralizing free radicals produced by light exposure and elevated blood sugar levels. Spinach stands alongside kale as one of the single rich dietary sources of these protective pigments available today. A single serving of cooked spinach supplies roughly 12 milligrams of these compounds, perfectly matching doses utilized in major clinical research studies. The landmark age-related eye disease study evaluated over 4,000 individuals suffering from progressive macular degeneration. Researchers discovered that among individuals with low baseline dietary intake, targeted carotenoid intake reduced the risk of advanced vision loss by 25%. This substantial 25% risk reduction directly applies to the vast majority of older adults who do not consume sufficient daily vegetables. This specific finding holds immense relevance for anyone concerned about diabetic vision complications. The exact oxidative damage that accelerates macular degeneration is severely worsened by consistently elevated circulating blood sugar. Diabetic conditions lead to advanced sugar-damaged protein buildup within delicate ocular structures, creating immense cellular stress. Lutein and zeaxanthin directly neutralize this oxidative stress inside the retina, regardless of the underlying cause. Notably, overnight glucose spikes, often called the dawn phenomenon, drive substantial vessel damage while you sleep. While targeted nighttime strategies handle early morning liver glucose releases, adding spinach protects daytime and evening vascular pathways. The third therapeutic pathway centers on direct blood sugar regulation. Spinach possesses an exceptionally low glycemic impact, registering around 15 on the standard glycemic index. However, its primary metabolic advantage stems from the active nutrients it delivers directly into your system. A single cup of cooked spinach provides 37% of your daily recommended magnesium requirements. Essential for cellular function, magnesium enables the key enzyme signals that allow insulin receptors to clear sugar from your blood efficiently. Without sufficient magnesium, insulin signals falter, whereas adequate levels allow cells to process circulating glucose rapidly following meals. Additionally, spinach contains trace amounts of alpha-lipoic acid, a powerful compound well known for supporting healthy nerve function. While whole food levels are lower than concentrated therapeutic supplements, consistent dietary intake helps reduce cellular stress across peripheral nerve tissues over time. Comprehensive scientific reviews confirm that regular consumption of dark leafy greens correlates with significant reductions in overall diabetes risk. Clinical measurements show that daily green vegetable intake can improve insulin sensitivity by over 12% in just 6 weeks. Thus, a single budget-friendly vegetable delivers nitrates for blood vessels, protective carotenoids for focal vision, and key minerals for blood sugar regulation. It is vital to explicitly point out this systemic medical gap, as standard healthcare specialization naturally creates isolated treatment silos. Specialists excel within their respective fields, yet broader connections between interconnected body systems frequently go unaddressed. An eye specialist focuses exclusively on vision structures, while an endocrinologist manages overall blood sugar metrics. The tiny retinal arteries that narrow under high glucose conditions fall directly into the unmonitored space between these two separate disciplines. Neither provider typically monitors your dietary nitrate intake, evaluates vessel elasticity, or connects daily blood sugar trends directly to microvascular health. This oversight is not personal negligence, but rather a reflection of modern medicine's fragmented structural design. Consequently, combining these crucial health insights requires proactive personal action on your part. You are the single individual who visits both clinics and understands how elevated glucose impacts delicate ocular vessels. Utilizing clinical research allows you to advocate effectively for your own long-term health during routine medical visits. Simply adding dark leafy greens to your daily dinner routine bridges this gap directly at home. Historically, civilizations utilize these exact plant properties for over over 3,000 years long before modern laboratory science verified the precise chemical mechanisms involved. Ancient medical manuals, such as the Sushruta Samhita, explicitly prescribed leafy greens to treat visual weakness and metabolic blood imbalances. Early healers observed distinct patient improvements without access to modern glucose meters or specialized eye imaging equipment. Similarly, historical Egyptian papyri documented dark greens in remedies for severe visual disturbances likely linked to ancient metabolic conditions. While the molecular mechanisms remained unknown for centuries, the positive physiological outcomes were documented across diverse historical cultures. Modern clinical science has finally explained why these ancient whole food remedies proved so remarkably effective. Regarding safety, individuals frequently worry about plant oxalates and their potential relationship to kidney stone formation. While oxalates can pose genuine concerns for susceptible individuals, standard daily portions present minimal risk for the majority of adults. Furthermore, basic cooking techniques effectively remove the majority of these naturally occurring plant compounds without destroying key nutrients. Boiling spinach briefly and discarding the water reduces soluble oxalate levels by up to 87%. Crucially, heat does not degrade the valuable nitrates, macular pigments, or beneficial minerals contained within the leaves. To prepare, simply boil fresh or frozen greens for 3 to 4 minutes, drain the liquid completely, and serve alongside your preferred protein. This quick 4-minute cooking method virtually eliminates oxalate concerns while fully preserving the underlying vascular benefits. Economical frozen options provide identical nutritional value to fresh produce at a fraction of the total cost. Most major retail chains offer affordable frozen packages for under $2 per bag. For optimal results, pairing cooked portions with a small raw salad maximizes overall nitrate delivery. Raw leaves release fast-acting nitrates into the mouth, while cooked leaves offer better absorption of fat-soluble visual nutrients. Before starting, individuals taking traditional blood-thinning medications must maintain steady, consistent daily intake of vitamin K-rich foods. Because vitamin K plays a role in natural blood clotting, sudden drastic changes in daily leafy green consumption can alter medication effectiveness. Rather than avoiding green vegetables entirely, eating stable daily amounts allows your prescribing physician to adjust dosages accurately and safely. Irregular consumption, such as eating large amounts sporadically, is what actually causes unwanted medication fluctuations. Additionally, rotating your choice of leafy greens ensures a broader spectrum of beneficial plant compounds over time. Combining spinach with other nutrient-dense greens like kale and Swiss chard offers comprehensive daily vascular protection. Kale supplies valuable sulfur compounds that support internal cellular defense, while Swiss chard provides high nitrate levels. Alternating these three versatile vegetables throughout the week ensures maximum nutritional variety while keeping weekly grocery expenses exceptionally low. All three options are widely available, cost under $2 per bag, and take just minutes to prepare. Beatrice adopted this simple weekly rotation, effortlessly adding a portion of cooked greens alongside her standard dinner protein 6 evenings a week. While consistent whole food nutrition noticeably improves daily blood sugar stability, addressing nocturnal glucose spikes remains equally important for overall metabolic health. Utilizing targeted lifestyle strategies handles early morning liver glucose releases, while daily leafy greens protect daytime vascular structures. Beatrice established a straightforward daily protocol, consuming 1 cup of prepared greens alongside healthy fats like salmon, eggs, or chicken. Because lutein and zeaxanthin require dietary fats for optimal absorption, pairing greens with protein sources maximizes their total bioavailability. On alternate mornings, she enjoyed a light raw salad tossed with a small amount of olive oil and fresh lemon juice. Within 4 weeks of starting this routine, Beatrice noticed a distinct positive change in the physical comfort of her hands and feet. At her 6-month follow-up exam, her eye specialist remarked that her retinal scans looked noticeably clearer with reduced vascular strain. When she revealed her simple daily spinach routine, he admitted he had never considered whole foods in relation to delicate microvessels. Bringing clinical research directly to your medical appointments fosters meaningful conversations regarding the vital link between metabolic health and eye care. Taking proactive control of your everyday nutrition offers a proven, highly accessible path toward protecting your long-term vascular wellness.